Thank you, everyone, for joining us for another Learning Lunch, co-hosted by Format Approved and eGestalt Technologies. We're having a little bit of a later lunch today than we usually do, but thank you again for joining us. Today's presentation is titled Compliance Officer, Roles and Responsibilities. Some brief introductions before we begin. I'm joined today by Anupam Sahai. Anupam's the co-founder and the president of eGestalt Technologies. He's a recognized expert in the areas of healthcare IT, cloud computing, security and compliance, and networking. Thank you for joining us, Anupam.
It's my pleasure to be here.
And I'm Brian Johnson. I'm the Senior Director of Online Education with Format Approved. I have extensive experience with HIPAA and compliance training, and so I am happy to share my expertise with you regarding the compliance officer role. Before we get into the presentation, I'm going to let you look at these questions that we're going to cover today and go over some very brief housekeeping notes with you. First of all, you can ask questions of us at any time during today's session by entering them into the chat area. We're happy to take your questions about the compliance officer role or really about any HIPAA question that you may have on your minds. You can put those questions in at any time, but we're going to save those till the end of our session, and then we'll address as many questions as time allows. If we run out of time and we don't get to your question, we will send you an email follow-up to address it. Note that all registered attendees of today's session will receive an email with links to both the slides and the recorded versions of the event. So if you're looking to get your hands on the slides, rest assured that we'll send them to you. All right, so let's get to our first question, which is why must every healthcare organization designate a compliance officer? And why don't you address that one, Anupam, if you don't mind?
Sure. So this is again coming from the HIPAA legal requirement, where, as you can see, 164.308A2, this is a subsection of the HIPAA regulation that requires that every organization, whether you are a covered entity or a business associate, you're required to appoint a leader of sorts who's going to be driving the compliance efforts. So what this requires is that there is a clearly defined role that has been laid out by the HIPAA compliance initiative, and so there is accountability, there is a need for training, and this person becomes the leader and the champion in the organization to be the point person for all of the security, risk, and compliance efforts from a HIPAA perspective. So that's the designation required by law, and we'll talk more about it as we go along.
All right, now this is one that comes up quite a bit, and the question is, does a business associate have to designate a compliance officer? And, you know, for anyone out there who's not familiar with the term, just in case, a business associate is someone who provides services to a covered entity, which is usually a clinician, and in the course of that service, they have access to patient information. The answer is absolutely yes. Remember that the HITECH Act, which was passed in 2009, and the Omnibus Final Rule, which was issued in 2013, they require business associates to comply to the same extent as covered entities with HIPAA. So, you know, that covers everything. That means they've got to have a risk analysis, but they've also got to do things like appointing a designated compliance officer. And so I think there's some business associates who may not have thought through the fact that they've got to have this point person. It's also great from a practical perspective because the compliance officer is key for doing things like securing business associate agreements with all of the covered entities that the BA may work with. And that's something we're going to talk about here a little bit later. And it's also worth noting that many business associates are in the IT realm, and having a compliance officer can be vital for implementing robust IT security. So there's both a practical side to why a business associate should have a compliance officer, but of course it's also required by federal regulations and by federal law, just the way it is for providers. Okay, does the compliance officer require specialized training? Maybe I'll take this one first, and then if Anupam has anything to add to it, that would be great. Um, First of all, the compliance officer does require specialized training in the sense that they should have more education in HIPAA than just an average member of the workforce. Now, remember that everybody who comes into contact with patient information, what we call protected health information, or PHI, all of those people have to have training in HIPAA, and that needs to be done on a regular basis. But members of the workforce can have brief training. That can be 1 to 2 hour training where they just need to understand HIPAA basics and make sure that they're following the law. The compliance officer needs more than that. The compliance officer is someone who should have training that's more on the order of 5 to 10 hours. But on the other hand, it's not like they need a specialized degree. These folks don't need to have, like a Bachelor of Science in computer security or something like that. But they do need to have a little bit more training than an average member of the workforce. The good news here is that they're not requiring you to have some, highfalutin designated security official in your organization, especially if you're a small ambulatory practice. Any member of the staff can potentially serve as the compliance officer. And we've seen in different practices, a doctor sometimes does it. Of course, doctors are usually pretty busy. So a lot of the time it's the practice manager. It can be a nurse. It could be really anyone in the organization. But they should get just a little bit more training so that they properly understand HIPAA because they're going to have more responsibilities around HIPAA. They're really the person who's going to make sure that the organization's doing what it needs to do. Would you like to add anything there, Anupam?
Yeah, no, I think you mentioned it, that the compliance officer is really the key go-to person. He or she is the leader or the champion in the organization for HIPAA. So it's very important for the compliance officer to be aware and educated so that they can impart the HIPAA culture in the organization. So training is a great way to get there so that the compliance officer is aware and trained properly, and then they can in turn act as a champion within the company to spread the message and get the good practices going.
Well, I think that leads into, and all of this is sort of led into this question, which I'm going to kick to you, Anupam, if you don't mind. What are the roles and responsibilities of the compliance officer?
Yeah, so as you can see here, this is pretty much a laundry list of roles and responsibilities that the compliance officer is responsible for. And as we have mentioned earlier, a compliance officer is really the key leader, is the key go-to person who's accountable for ensuring that HIPAA compliance is ingrained in the organization. Not only that, they are responsible for ensuring that all the requirements of HIPAA is being met. So what does it mean? It means that anything that HIPAA requires from a privacy and security of PHI, protected health information, which is really the core objective of HIPAA. If you take a step back, the core objective of HIPAA is to ensure that protected health information or patient health information, which is the key asset, is protected. And it's protected through a set of privacy and security related best practices, policies, procedures, or technical safeguards. And so the compliance officer is really overseeing the whole effort to ensure privacy and security of PHI. So whether it's ensuring policies and procedures are in place, if things change with time, they need to be on top of it to ensure that they're aware of any new employees that are coming in, any IT infrastructure that's changing, or any policies that are changing, if there are need for training inside the company to ensure that everybody is aware of their responsibilities and their role in the organization to contribute towards HIPAA. That is all part of the role of the compliance officer. And if there is a breach or if there is an audit request from the government, then the compliance officer is really the key person that gets connected and contacted. So in many ways, compliance officer is the key go-to person, and they oversee the entire effort required for assessing, maintaining, and monitoring the HIPAA compliance and security status for the organization.
All right. Well, let's take a look at our next slide then. There's a lot to cover there, and we're going to go into more detail about what some of those roles and responsibilities are. So this is something that I know you've had a lot of personal experience with, Anupam. So again, I'd ask you to address this one if you don't mind. And that's, how is the compliance officer critical in the event of an audit or a breach investigation? Because, that's something where no organization wants to be in that place, but if they do get to that place, why is the compliance officer so important?
Yeah, so compliance officer in the case of an audit or a breach investigation, as I said earlier, is the key go-to person. So if there is an audit request from HHS or OCR, which is the Office of Civil Rights, which is the enforcement agency for HHS, they would, as you would know, that HHS has decided to randomly select about 5% of covered entities or BAs to do random HIPAA audits. So once they select a particular organization for a random audit, they would essentially write a letter, a formal letter, addressing the compliance officer of the company, saying that we would like to audit you, and here are the criteria that we're looking into. And the HHS audit protocol criteria is very well laid out. But the bottom line is the compliance officer is really the first point of contact, whether you're being audited by HHS or for whatever reason, if there's a breach. And the breach could happen because the PHI information, which is the critical asset that HIPAA is trying to protect, has been compromised. The information could be compromised either because of internal misuse or mishandling, or it could be because a cyber attacker broke into your organization and stole some information. But in either scenario, the compliance officer has a role and a set of responsibilities in terms of actions and procedures that they need to follow to respond to the government request or to inform the government in case a breach happens. So again, the compliance officer is the key role responsible for driving all of this effort, as I mentioned earlier.
Yes, and just to reiterate, to that, the second bullet there, we've heard of stories where someone's faced an audit and the government, the first thing they say is, we need to speak to your compliance officer, and if you can't answer that question, you're dead in the water. You've already failed right from the get-go. Well, again, not to let Anupam steal the show here, I'm going to jump in again here on the next slide, I think, but when it comes to a risk analysis, that's something that you do every single day, Anupam, and so I'd like you to explain to our audience how the compliance officer is so crucial to that process.
Sure. So what does it mean to do security risk analysis? Let's start there. So by doing a security risk analysis for your organization, you are trying to get a sense of the risk exposure for either a malicious insider or an external attacker to break into your organization and compromise the data. So you're trying to assess the risk that you have as an organization to deal with attackers. And if you're highly risky, that means it's easy for anybody to come in and steal the information. So the risk analysis assessment allows you to understand the overall gaps that exist from a HIPAA compliance perspective and how severe those gaps are from a risk exposure perspective. As a compliance officer, you are part and parcel of this whole assessment for security risk analysis. And you might, as a compliance officer, you will work with other stakeholders in the company. It could be the IT manager, it could be the people who are faxing information or faxing references for other labs and specialists, what have you. Anybody and everybody who touches PHI information needs to be in the loop. And as a compliance officer, you're working with all the activities that are required to do security risk analysis, including people in the organization. And so there is training requirements here. And as a compliance officer, you are the project manager or the overall champion and the leader for the risk analysis effort.
All right. Well, before I get to this question, I know we've had a few people out in the audience ask if they can get their hands on the slides for this event, and I just want to reiterate that we will provide those after the session, so don't worry about that. All right. So Anupam was just telling us about the risk analysis and how important it is to have that compliance officer get everybody in the loop and get all the information needed for it. And part of what they're going to be dealing with in that risk analysis is HIPAA documentation. So I think I'll take this one. About half of all of the HIPAA requirements are administrative, which people sometimes don't realize. So there are technological aspects to it. But really, a lot of what HIPAA is dealing with is proper policies and procedures. And if you don't have updated policies and procedures, you cannot be HIPAA compliant. And so this is another example of where the compliance officer is serving in this important coordinating kind of a project management role where when you're doing the risk analysis, they're going to be going through those policies and procedures to make sure that they're adequate. So having that person there to perform that process, to go through that and make sure that you've got adequate policies and procedures is a vital part of doing a good risk analysis, and it's a vital part of becoming compliant. The other thing to keep in mind is that, of course, it's not enough just to have policies and procedures in some binder like the one that the doctor's holding there. You've got to actually follow them. And there have certainly been cases where organizations have gotten into trouble because they've got a great set of policies and procedures that they absolutely do not follow at all. So it's almost like, just some science fiction theory of what their actual policies and procedures are. So the compliance officer, on the one hand, needs to organize that documentation and participate in the risk analysis, but they also need to make sure that people are actually following the policies and procedures. So that's another important part of actually being compliant with HIPAA. And so our next question then has to do, and it sort of speaks back to what we were talking about in an earlier slide about business associates. How can the compliance officer manage relationships between covered entities and business associates? Well, I said before that the business associates need to have a compliance officer because that person can help them get business associate agreements in place. So that's one obvious thing that needs to be taken care of. But really, it's more than that too, because the business associate agreement, one of the things I like to say about it is, there's actual words in that contract, and what they say is that you are legally committing to being HIPAA compliant and to protecting PHI in certain ways. Sometimes people act like if they just sign the BA agreement but do nothing else to follow HIPAA, that they've done what they've got to do. But that, of course, is not true. So the compliance officer of each organization can work with the compliance officer of the other organizations. So sometimes people ask me, what if we have concerns about a BA? How can we figure out if they're actually doing what they should do? Well, the first thing you should do is ask them to speak with their compliance officer. And if they say, well, we don't have a compliance officer, then you know right there that they're not compliant with HIPAA, because to be compliant, you must have a compliance officer. And so this, the business associate agreement is one aspect of it, but compliance officers of different organizations should be able to speak with one another and coordinate, and then, they should be able to answer detailed questions about HIPAA. So if you have questions about whether the business associate has this policy in place, that's something that the compliance officer should be able to answer, and there should be no problem with getting you in touch with that person. I wonder if you'd like to expand on that at all, Anupam.
Yeah, no, this is a very critical point. So as per the HIPAA Omnibus Law that came into effect September 2013, covered entities and now business associates are responsible and liable to ensure that they are compliant with HIPAA. Not only that, covered entities have a shared responsibility and a shared liability to ensure that all of their BAs are HIPAA compliant. So having a BA agreement is a good first step. It's a necessary step, but it's not sufficient. What is required now is that every covered entity be proactive about ensuring that all of their business associates are indeed compliant with HIPAA and that they're taking steps to ensure privacy and security of PHI. So there is a need for a big channel of communication that needs to be opened up from the covered entity compliance officer to BAs to ask them about what kind of HIPAA practices do they have in place, have they done security risk analysis. So everything that the covered entity does internally should also be followed by a business associate. And again, that's part of the shared responsibility and shared liability clause. If a BA loses information and they get attacked by hackers or there's misuse of data internally, guess what? The covered entity also can be fined because of the loss of data. So there's a big issues at stake here. There's a big risk and liability numbers that affect the entire value chain of covered entities and BAs and subcontractors. And it's important that everybody works with each other to ensure privacy and security of the PHI information.
That's a great point, Anupam. Even though business associates are now directly responsible under federal law for breaches and for all HIPAA compliance, there's still an extent to which the buck stops with the covered entity. So if you look at the example from this last year, there was a huge breach in LA County where a business associate had a break-in and burglars ran off with some desktops that contained somewhere in the neighborhood of 300,000 health records. Well, it's the covered entity that had to inform all of those patients that their health records had been taken, even though in a sense, it was the business associate's fault. So really, both of those parties are in trouble, and there's a number of lawsuits underway regarding that case. And so both the business associate and the covered entity are on the line for that, and that's why it's important that everyone work together to make sure that they're compliant. And though it's not really the focus of this event, I just have to say, that if the business associate had only encrypted the records on those machines, there wouldn't have been a breach in the first place. So that's always something that people need to keep in mind. All right, so how is the compliance officer then critical to successful training? Well, this is something I deal with on a daily basis, so I'll take this one. It's again a project management question. The compliance officer is the person who should make sure that everyone completes that training and that they should do it on at least an annual basis, if not more often. If you make a change to your environment that's significant, you need to train on that as well. But generally, that's something that you should take care of every year. And it's everyone who comes into contact with protected health information or who has access to it. So that's something that the compliance officer needs to make sure gets done. These days, it's easier to organize than it may have been in the past. I've heard people try to do this with spreadsheets where they're, keeping a kind of messy Excel spreadsheet of everyone and when they got their training done and when they need to get the renewal done. It really should be simpler than that. We use an LMS, that's a learning management system at Format Approved, where you can just log in and see everyone's training status and run a report on it. And, whatever system you're using, whether it's us or somebody else, I think that is just sort of the minimum you should ask for at this point. We're living in a digital age with cloud-based technology. You shouldn't have to keep kind of a scraggly old spreadsheet to make sure that you're getting your compliance done. The other thing I'll mention is that it's not enough just to train on the law. You actually need to make sure that staff understand what your own policies and procedures are. So that's another example of, people will buy templates for policies and procedures that are really slick, that refer to all the federal regulations and everything, but then if the employees don't follow them, then it doesn't do you any good. And that's not just a question of if you get audited, they're going to try to get confirmation from you. They're going to actually interview employees and such to make sure that they understand the policies and procedures. It's really a matter of preventing breaches. The reason why you have those things in place is because that is your best defense against a breach. And the truth of the matter is that although the government does audit people, there's many, many more breach investigations than there are audits of organizations. And so if you can prevent a breach, that is your best defense against getting into HIPAA trouble. And so having a robust set of policies and procedures and actually following them, training your staff on following those procedures. That's really what the law is all about. The government says that the purpose of HIPAA is to create a culture of compliance, and that's something that Anupam mentioned earlier too. And that's really what we're talking about here. You want people just to have as part of their daily work routine this culture of compliance where they're doing what they need to do to protect the privacy of patient information. Anything you'd like to add there, Anupam, or shall I move on?
Yeah, let's get to the next slide, please.
Okay. Well, maybe I'll ask you this question then, Anupam. What are some other things that we may not have covered here in terms of what the compliance officer can do to improve compliance?
Yeah, so it's really about, besides all the designated roles and responsibility that the compliance officer has to ensure, really it will help the compliance officer to have some kind of awareness and training program for the organization where they're really providing and creating a culture for HIPAA-related topics. So this could be done through internal trainings about what each employee and how can they contribute towards HIPAA compliance. There could be brown bag lunches, posters, login messages, keep folders of the policy manual around for easy reference. So there are lots of fun ways that the compliance officer could potentially adopt to really create a culture of HIPAA compliance, so that it becomes easier for everybody to speak up, to understand what the requirements are, to maybe ask questions, and thereby have some kind of a shared responsibility in the company. Rather than one person owning it, it becomes a joint responsibility of the team that is working towards a common goal. So it's really about inspiring and leadership and creating a team effort and creating a culture of HIPAA compliance that really goes a long way, because at the end of the day, a single person cannot make everything happen. And creating a culture and awareness and education would help the compliance officer to implement and monitor the HIPAA compliance status for the company.
Well, those are great points, Anupam, and that goes into our last question here, which is, what does it mean for the compliance officer to serve as a HIPAA champion? And that's really what you were just speaking about. To kind of flip it on its head, as I say in the first bullet here, not everyone is excited, as excited about HIPAA compliance as Brian and Anupam might be. I mean, I actually enjoy HIPAA quite a bit, but some people say that that's, some kind of mental illness. Talking to providers out there, a lot of folks, they didn't get into medicine because they were so excited about HIPAA, let's put it that way. So some people see it as a chore, but the compliance officer is somebody who needs to serve as a champion, the way Anupam was just saying, by organizing activities in such a way, making it fun as much as they can, serving as a cheerleader, and then when necessary also serving as a taskmaster to just get everybody on board and make sure that you do everything. The compliance officer is just so vital for making sure that everything gets done to make your organization compliant. Anupam?
No, I think it's kind of a reiteration of what we said earlier, that the compliance officer is the key go-to person. He's the champion, he's the leader for HIPAA compliance in the organization. And the compliance officer would be, it's good that the compliance officer needs to co-opt other people in the organization who are going to be working with him or her to make sure that HIPAA compliance is assessed, managed, and maintained in an ongoing fashion. And to maintain HIPAA compliance, it's important that all the stakeholders are part of the whole effort, part of the initiative, and whatever it takes to get them to be interested, excited, and participate in the whole HIPAA compliance initiative should be done. That's really the responsibility of the compliance officer as the key person to and the champion for the organization.
Yeah, we've hit this point over and over again, but it's just one more time, I gotta say, if you didn't have the compliance officer in place, it's just too easy to let things kind of slip through the cracks. So having that person there who is really in charge of making sure everything gets done is absolutely vital. So we've got plenty of time for questions from the audience. Again, as I said before, we're happy to answer your questions about the compliance officer role. But, you got in Anupam here, you've got a great expert on everything to do with the risk analysis and really everything in terms of HIPAA and high tech. So whatever your questions are around HIPAA, we'd love to talk to you about those issues. This is a great chance to get some expert advice on whatever issues you may be facing. This is our contact information. Like I said before, we're going to send these slides out to you after the session, and we'll send a recording as well. But you should always feel free to contact us by phone or email. So look for those slides after this event. I'm going to go to the next slide where we've got some offers for you before we get to the questions. So again, go ahead and ask those questions if you have them. The first one we've got from our audience is, how do we handle HIPAA with independent contractors? Nupam, you want to take that one?
Sure. So as per HIPAA Omnibus, whether you are a business associate or an independent contractor, your responsibility and the requirement from a HIPAA law perspective is that they both need to be compliant with HIPAA. So independent contractors need to safeguard and ensure privacy and security of PHI information. So they are no different than a business associate from a responsibility and liability perspective. So if you are a business associate or a covered entity, treat subcontractors or independent contractors as a business associate, and as an organization, contractors need to ensure that they're handling PHI information correctly. If you're dealing with individuals, the same argument can be extended to them, or if you're dealing with contracting organizations, and it's a BA situation, no different than a regular business associate, and you need to put together a business associate agreement along with do a risk analysis for the contractor organization to ensure that if they are sharing PHI information, that they're not that they're able to safeguard it and ensure privacy and security of PHI.
That's a great answer. And just as a point of clarification, the issue of whether or not someone is covered by HIPAA, whether they qualify as a business associate, it's pretty simple. It's whether they have access to protected health information. And one area where it's not so simple, where it gets a little tricky and people sometimes get confused, is when it comes to cloud services. People are using more and more cloud services. They're using the cloud for their EHR, which is great. That can help you really simplify some aspects of your business. It even simplifies some aspects of HIPAA compliance because, for example, there's disaster recovery provisions in there that sometimes people don't pay much attention to, that the cloud can actually make it easier for you to meet those requirements. But one of the things that the Omnibus Final Rule changed, and that's caused some people some confusion, is that it says that even if you're just maintaining PHI now, you are a business associate. So sometimes people will say, well, I've got PHI loaded up into a server off in the cloud, but the server company never looks at the PHI. The server's locked in a cabinet, so they're not even a business associate. Well, under federal regulations now, they are a business associate because they're maintaining that health information. And I think the logic here from the government's perspective, they never explain exactly what they're thinking, but I think it's safe to say that what they're trying to do here is they recognize the fact that more and more stuff is going to move into the cloud. We're just in the early days of it for healthcare, and they want to make sure that people who are entrusted with PHI are actually meeting the requirements to protect it. They don't want a cloud organization that just doesn't understand anything about HIPAA and doesn't care about what the HIPAA requirements are to have all this PHI and run a risk that it should get breached. Before we move on, I want to talk about the opportunity on your screen there. If you've been thinking, well, I don't really have a compliance officer and I need to get one and I'm not sure what to do, we do have a special offer for everyone on the workshop, or if you're listening to a recording of this, and that's that we're going to launch a workshop series on compliance officer training that starts tomorrow, and we're happy to give everyone on this call $100 off on that. So it's a great series. I think it's going to cover, it goes over 4 days, but if you can't attend the live sessions, that's okay, because there's all of them are going to be recorded. And so the way it works is we go through our CHSP certification, and this gives you a way to have an instructor lead the classes. I actually lead those. So we make every effort to make them lively and entertaining. But then if you can't attend the live workshops, that's okay, because we load all of that up into our learning management system, and so you can log in and view the recording. At the end of it, you take a test. The test, you get lots of prep for the test, so nearly everyone is able to pass that. And then you meet that requirement, the training requirement for that compliance officer. And so you can get it for $100 off. One other thing I'll throw in there is that we've talked over and over again in this session about the business associate agreements, and everyone who signs up for the course, we throw in business associate agreement templates for both the business associate and the covered entity, but then also business associates, if you have subcontractors that get access to PHI, you have to have agreements with them too. So there's a version in there for business associates and their own subcontractors. Before we go on to the next question, I want to mention as well that, the first requirement of the security rule is that you get a risk analysis. We've talked about the importance of that. And so if you're looking to get that done, I know a lot of people are kind of scrambling at the end of the year. Maybe they're doing their attestation for meaningful use, and remember that meaningful use also requires a risk analysis. There's not a lot of time left to do that, but if you go to ForMed Compliance, there's still plenty of time to get that done. Professionals with eGestalt will work to get that done for you, and it's really top-notch, really best in the industry service that they provide. And so that's another opportunity that you should take advantage of. Really greatly discounted prices available at that website. So those are some things you should be aware of. I'd also urge you, if you have questions about HIPAA, to contact eGestalt. You can see the URL for their website there. eGestalt is really a great company that knows HIPAA better than anyone else around. So let's go to the next question then. And again, if you've got questions out there, please feel free to ask them. This question is, if you are a BA that serves as a consultant to assist with quality improvement and meaningful use, but you don't look at or carry out any PHI, does this scenario still constitute as a typical business associate? What would you say to that, Anupam?
Yeah, so I have some follow-up questions on this. If a BA is assisting with quality improvement and meaningful use, then they are potentially looking into PHI information. So I'm a little confused by the question. So if you can reach out and drop either Brian or me a note with the exact description of what you're doing, how you're looking at meaningful use information but not looking at PHI, is a little confusing to me. So it's a little difficult to answer right based on the question that you asked.
Yeah, if somebody's just giving you kind of general advice on meaningful use, well, it's conceivable that they wouldn't be a business associate. But usually someone who's serving in that consultant role is actually implementing. And so anyone who's going into the EHR and working with, say, the meaningful use dashboard to do attestation or anything like that, those are people who have access to PHI. So I would think that they would, almost certainly be a business associate. So I would agree with Anupam that you need a little bit more information really to answer that one, I guess, is the answer we can offer right now.
That's right.
All right. Well, I'm not seeing any other questions from our audience. If anybody has questions, go ahead and ask them now. If not, we'll go ahead and start to wrap up here. You can always send us emails if you do have other questions. Again, do take advantage of that opportunity to participate in those workshops to get your compliance officer training. You can join us for our next Learning Lunch session We're always happy to have you for these free events. We cover everything from HIPAA to PCI DSS compliance to meaningful use and EHR. You can go to our homepage and click on the Learning Lunch lunchbox to see our upcoming events and register for those. So do join us for our upcoming events. I want to thank you, Anupam, for joining us. It's always a pleasure to have you with us, and your expertise is certainly a great asset at these events. Thank you.
Thank you for inviting, and it's been my pleasure. And I would like to thank all of you for attending today, and thank you for your time as well.
Yes, and thank you to our audience for joining us again. Remember that we're going to send out a follow-up email that's going to have the slides and the video recording of this event. Keep an eye on your email box for upcoming learning lunches and other free resources from Format Approved. And thank you again for joining us today.